Hey YouTube, welcome to another video from SkinnyMedic. I have my good buddy here, Eric from Iraqi War Veteran 8888. We've been talking medical and trauma supplies all day, so kind of wanted to have you on my channel if you don't mind. So.
Outstanding. I appreciate it. You know, medical preparedness is extremely important, and I know that a lot of us, when it comes to the way that we handle certain things, sometimes it's easy to think about, oh, well, it's never going to happen to me, and I'm only going to poke holes in things. I'm not going to worry what happens after a hole gets made in something. But, you know, in the real world, stuff happens, and, you know, you got to be ready.
Exactly. So one of the things we talked about was tourniquets, and, you know, I offer the cat tourniquet in my kits. You had AR-500's kit who's got the SWAT-C tourniquet, so I want to kind of just demonstrate them and show them to you, let you practice with them on camera. So
absolutely.
The cat we talked about needs to be staged, and it can be staged in, you know, a leg configuration or an arm configuration. And I normally set mine up for an arm. So to stage it, really you just run the tip through. If you get it about 6 to 8 inches past there, it's staged, it's ready to go for an arm. So then you put it on. This gets pulled as tight as you can get it here, as if you're trying to cut off blood flow just by pulling this here.
Sure.
And then you spin the windlass. And then usually about 2 to 3 turns and you can get blood flow to stop right there.
Mm-hmm. Absolutely. So the whole idea of staging one of these up, especially for, you look at like a soldier who is going to be carrying this as an individual, you know, first aid kit, Ifac. That's kind of a little term that gets thrown around a lot, is the Ifac, which is basically a blowout kit. You'll generally have them staged up for a leg or an arm or whatever. Mm-hmm. But what we were talking about earlier, I like the idea of this being able to do with one hand. So like, all right, oh, I'm hurt, oh crap, pull it out. Put it on. All right, that's where I want to stop the blood flow, and I can tighten that on my own.
Yep.
And the thing about it, what a lot of people generally don't consider, is that it's difficult to hurt yourself. A lot of people don't think about it because, you know, you were telling me earlier that, you know, some guys that you've dealt with putting on a tourniquet before, it's not even the loss of the limb that's horrible. It's the fact that, oh crap, that tourniquet hurts like hell.
Yep.
And applying a tourniquet is painful, and you are basically causing pain to yourself. So that's something you have to be mentally prepared for, is that when you're applying a tourniquet, it's going to hurt.
Definitely. And then the other one here we had too was a SWAT-C, because this was in your AR-500 Ifac we took a look at. And so it's basically the same thing, where this one's made out of composite, this is more of a metal here. Mm-hmm. So same thing, it locks on. You kind of have to use a little bit motion here. And then this spins. Windlass spins, it locks into the triangle here. So it's a little bit different setup. They're going to take some training to get used to.
I have to say the design of each of these tourniquets, they both seem like they would lend themselves quite well to being used in the field and abused. I know with the cat tourniquet, something we mentioned before was that these plastic clips here have a tendency to want to break.
Yep.
Especially, you know, if a tourniquet, I mean, let's face it, how many times are you going to have to use your tourniquet on yourself if it's a combat situation? So sometimes these tourniquets will lay around, they'll dry rot, and the plastic will eventually, you know, decay and somewhat break down. So they have this little bit of redundancy here, which allows you to physically lock this in place, so it keeps it from coming out. But then you've also got this handy time stamp right there, so you can write the time that the tourniquet was applied, and that way you know how close somebody's getting to losing a limb.
Exactly. So I introduced Eric into the Gen 7 cat here as well. So we talk about staging the cat, where this one has to be staged for the buckle. This one doesn't. This one is strictly just has the one single buckle, so it can just go for a leg or an arm. It doesn't have to be staged. And the plastic windlass here is now thicker, so they knew that was a problem. So the Gen 7 definitely has some upgrades over the older tourniquets. They're still good tourniquets, it's just everything gets upgraded over time.
Yeah, and there's nothing wrong with upgrading something through experience. You know, a lot of these tourniquets, primarily the cats, are the ones I'm the most familiar with from being issued these in the military, is that as something gets used, you're gonna find a way to upgrade it and fix it and make it better. And you know, I've got in my individual first aid kit that I have, my Ifac that I used overseas still has a Gen 1 cat in it.
Yep.
It's still a usable tourniquet, you know.
So another thing too we talked about was the pressure bandages, and these are really good to have. These are pretty reasonably priced too. I mean, the tourniquets can get expensive. where these pressure bandages are really affordable for what they, I mean, you're talking, you can find them used for $5 or $6. I'm not used, it's, you know, surplus. You don't want to use one.
No, you don't want to use one.
But like surplus, you know, $5 or $6, brand new, they're like 12. So I mean,
absolutely,
they're very reasonable price. So this is the Israeli bandage here because it's got the plastic clip on it. So when you wrap this on, you want to go through the plastic clip and then come back on top of itself. So this works good as a pressure bandage. You can also use it as a tourniquet as well. And then this is another style pressure bandage. This one doesn't have the plastic clip. So you just kind of keep wrapping on top of each other and then it secures. So if I were going to put this on your arm, this 5x9 here goes where the wound's at. We lock it on and then we go through the plastic clip here and then rotate back on top of itself. So then we keep spinning it. When we get to the end, it has a little plastic clip to hold it in place. So that way you've got your bandaging there.
The key here is pressure.
Yeah, so as you would pull around, if you're going to really apply some real life, you'd want to pull and get some real tight pressure. Because you could make a tourniquet out of this. If you, the more you pull, because it's so wide, you can get a tourniquet out of this. So here's the plastic clip. Then when you make your last round, you just clip it back into place.
Yep.
So it's really nice.
I've always been a fan of the Israeli bandages. They're excellent.
You can bandage shoulders, heads. There's a lot of, you know, if I tell people if you're going to buy one thing for your trauma kit to start out, I'd buy an Israeli bandage because you can make a tourniquet, you can splint a shoulder, head, all kind of things like that.
Not only that, you know, you can also stuff even more on top of this. If this pad here is not going to be enough, if you think the bleeding is going to be a little bit more severe, you can always throw some coagulant on there or maybe more gauze. You know, bundle up gauze. At that point, anything you can stuff in the wound to slow down the bleeding is always going to be a good idea. Anything that can help keep pressure. Also, if a guy, I don't know, has a huge, you know, some people are big. They might have a huge arm, huge legs. You can also stage these things up, you know, if you need to, and make up that extra difference in, you know, somebody's body size if you need to. And
so this one is a little bit different style here. It just doesn't have the plastic clip. So how we went back on top of each other, this one just keeps wrapping around. So it's still the same process, still 5x9 here. And like you were saying, you could use hemostatic agent like combat gauze, Celox, whatever you wanted to use, and just keep wound packing and use this also as a second tourniquet. Talking about guys with big arms, big legs. Sometimes you may need a second tourniquet. Well, if you don't have one, you can use your pressure bandage as well.
Yeah, or you can even use this as like a spacer, something to add additional, you know, girth to make up the difference in a tourniquet that might be lacking. You know, there's a lot of things you can do with improvised tourniquets. I know you've seen, you know, stories where guys will rip out their belt and use it. You know, a piece of random pipe like they find somewhere in a belt. You can make a tourniquet out of just about anything. You can make a tourniquet out of 550 cord.
Yeah, I mean, you're going to have to improvise. You know, a lot of times we may not have the stuff with us, and you got to improvise.
Yep.
So one of the main things we want to take care of is, of course, bleeding and then breathing. That's, you know, the hemorrhage control is huge right now, and obviously you don't want to bleed out in the arms, legs, something like that. But then, you know, chest seals are also something else they're seeing, especially with these mass shootings, active shooters. They're now finding that a lot of this stuff is getting in the chest, you know, because cops, military, they wear protective body armor, we don't. So these civilians are getting shot or getting hit center mass.
Yeah.
So, you know, having chest seals is something maybe not a bad idea to add to your kit. And so what I have in mind is the hyphen chest seals, and these are vented, and I'll show them to you. You pull the red tab. A lot of times under stress, you know, just same thing with a firearm, you get a stress, you can get tunnel vision. Also, people talk about they lose color. Like they just can't see color, so that's why they went with the red to kind of grab your attention. And then, so then this comes a little 4x4, that way if you get a little bit of blood, things like that, it'll stick. Wipe it off. So then you pull this red tab here, and then this sticks onto the chest, directly onto the chest. And this is super sticky. Like it'll take a chest hair off of you.
Oh, no doubt.
So, and it's vented too. We talked about, like with a pneumothorax, that's when pressure starts building up in the chest. It can be pressure of blood or air. So the lungs, like if you had a gunshot wound here, your lungs are going to start pushing over here, and that's going to compress your heart, and your heart freaks out, and it starts beating really fast, and it dies. So that's why this pressure will allow it to vent out. If it can go wholly, why we have the vented chest seals here.
Okay, so that literally goes over the wound.
Goes right over the wound.
The wound goes right here, and that allows it to vent.
Yep. And then, so it comes with 2 packs. That way, because you get the entry wound, make sure you check the backside and clear it. Make sure there's no hole on the outside.
You know, that's one thing that in the military we were always taught about evaluating a casualty, is always checking under the uniform with your hands and looking at your hands to see, you know, if a guy's laying on his back, you always want to make sure that you're seeing if there is some form of exit wound or a wound somewhere that you may not know about, So that definitely comes into, evaluating that casualty. I was an infantry guy, so from my perspective, I'll admit, infantry, when it comes to medical training, generally it's one of those things where you ask most grunts and they go, oh, what are we doing today? Oh, we're doing medical training. Oh, nobody ever wants to do medical training. Everybody hates medical training, but it's essential. Believe me, because the thing is, guys kind of frown upon the medical training and they don't like it because it's not high speed and getting out there and shooting things up. But it's just as important. Being able to save a life is just as important as taking a life. So with these front and back entry and exit gunshot wounds, and normally these things come, like I see they're perforated, so they come kind of together.
Yeah, they come together that way. When you're in your kit, everything's locked up.
Gotcha.
So there's other things you can add to your trauma kit, your blowout kit, but these I feel like are the most important, the essentials to add in there.
Absolutely. So this is something that you can go and buy a cat tourniquet. You can buy the Israeli bandages. I've seen these things at Army Navy stores for like $2.
Yeah.
So even if, let's say that a lot of times these things will come packaged like in a little shrink wrap or something or whatever, and say the date has passed on them, and the date, in terms of the sterile factor, okay, it may not be technically sterile anymore. In the standpoint of, let's just say crap hits the fan or prepping or something like that, I'd rather have 150 of these laying around that I picked up for next to nothing, and something happens, and okay, so it may not be 110% medically like sterile. Wah.
But what we're using that for, you're just controlling bleeding or stopping bleeding. You don't care if it's sterile. You may use a T-shirt, you may use other things. So this is plenty just to just get the bleeding to stop.
Well, yeah, if the bleeding getting stopped and you're dead, it ain't gonna matter if it's infected because you're not alive anymore. So these things are great. I found these at surplus stores for really reasonable money. I need to pick up more of them actually. Those are great. But yeah, this is very important, and I'm glad that you were able to get me on this, to talk with you about it. Medical is just one of those things that I believe probably universally when it comes to preparedness, okay? Everybody's going to have like food and water, rations, lagoons, beans, all this other stuff, water purification. That's another thing to have in an Ifac these days. You never know if you're out in the middle of nowhere, you need to purify water. That's probably not a bad thing.
Yep.
And then guys have guns and ammo and all this stuff. But universally, I believe most people are probably the most ill-prepared medically.
Yep.
And I think a lot of it's fear of the unknown. A lot of people just don't feel like they are going to be able to do it. They don't have that confidence level. I can grab any gun on the wall and know exactly what I'm doing with it. But I'm a gun guy. You're a medical guy. If this room was stocked full of medical supplies, you would just grab what you needed, do what you needed to do, and it wouldn't be a question as to what had to be done.
Right.
So that's the way I kind of look at it in terms of the whole medical, thing. Most people are definitely ill prepared for a medical emergency, and that definitely has to change in this world we live in. Especially from the blowout standpoint.
Hopefully we can do it. So
absolutely.
I appreciate you being on the channel. Thank you guys for watching. You never know when you'll be the first responder, bringing the right gear and the right training.
Thanks, guys.